Okay, good morning and welcome to Open Day at UQ. My name's James Fraser. I'm the Head of Assessment for the medical program, and along with my colleague Dr Margot Lane, we're going to talk to you about medicine at UQ this morning and hopefully entice a lot of you to apply and come along and join us in what we think is a fantastic medical program. So Dr Lane's going to take us through the first part of the talk and then I'll do the second part.
Thanks very much, James, and I'd like to reiterate welcome very much to our talk this morning. We always enjoy talking to people outside the booth as well, so if you've got any questions that you'd like to talk to us about later on, please come and say hello and ask anything. We've just changed our job title, so I'm just trying to remember what I am. I'm the academic lead for Phase 2 in the medical program, which means essentially I'm looking after the Year 3 and 4 students. So we're really just going to give you a bit of an overview of the medical program. I'm going to talk to you a bit about the opportunities of studying medicine at University of Queensland, and then go on a little bit to how you apply and how you get in the different pathways to getting into medicine at UQ. So as I said, a little bit of an overview, and I guess one of the things I like to say to a group of potential students is thinking about the opportunities of having a medical degree. I guess there's the very obvious thing that a lot of people come into medicine because they really want to be a doctor. They want to be a clinician, they want to see patients, they want to diagnose, they want to help people, and that's obviously a very, very strong underpinning philosophy of the medical program. I guess that there's a couple of other things that you can do with a medical degree, and sometimes that's quite surprising to people. They don't really think that there's other things you can do. One of the big things we have at UQ particularly is that you can take your medical degree as a clinician and also become a researcher. And we have a very strong research background in the university as a whole, and also with the introduction of the MD program, we believe we've really ramped up the research in the medical program itself. So when you graduate with a Doctor of Medicine, you also have the skills to progress into a research career. We also think that our students have wonderful leadership capabilities, and we are really harnessing that through a number of different initiatives in the medical program. And there are many doctors out there who practice for a short time as clinicians, but move on into very senior and very important leadership roles in the community. And that's another opportunity that students who graduate from our program can actually link into. One of the things we're very proud of is being the oldest medical program in Queensland. And we're celebrating a very important milestone this year, our 80th birthday. That's a drawing, obviously, of the medical school out at Hurston. Many of you may have driven past that amazing old building just near the old Royal Children's Hospital, near the Eka actually, if anyone's been to the Eka this week. We're having a lot of wonderful celebrations, including open houses and gala dinners, but I think that that's one of the strengths of our program. We have a huge amount of experience in training doctors, and training doctors who not only work and practice in Queensland, but throughout Australia and internationally. We're very proud of the global spread of our graduates. So we were founded in 1936, as I said, and we have since then graduated over 14,000 doctors. We have full accreditation with the Australian Medical Council, which is a very robust process of accreditation which is ongoing, and it's a continuous process and makes you very comfortable with the fact that we fulfil all the requirements necessary to graduate doctors from an Australian medical school. I've mentioned we're the largest program. However, we feel that we have indeed managed to have the largest program, but with significant amount of small group teaching and clinician interaction with our students, which I'll go into in a little bit more detail. We're also a highly ranked medical program, being number 30 in the field of medicine on the QS World University Rankings for this year. And the University of Queensland itself is also a very highly ranked institution on these rankings. So I'm just going to go over the actual program relatively briefly, but just so that you understand what types of things you'll be studying and how the program's divided up when you do get into our program. For those of you who don't know, we are a 4-year postgraduate program, which means that every student who comes into year 1 of the MD has already completed a minimum of a 3 years bachelor's degree. And this can be any type of bachelor's degree. We have students from a huge range of backgrounds. We have musicians, engineers, we have astrophysicists, we have pharmacists, we have therapists, we have psychologists. We have students from a vast range of backgrounds, and we feel, again, that is actually a strength of the program. We will talk a little bit more about entry requirements, but the bachelor's degree is the minimum. Obviously, you can have a 4-year degree or you can have a research higher degree as well. So all students coming into the MD program have completed at least a 3-year program. We divide it, the 4-year program, we divide loosely into 2 halves. So phase 1 being years 1 and 2, and phase 2 being years 3 and 4. In phase 1, it's a similar program to an undergraduate program for the first year. Students are generally at St Lucia campus, and they have 4 different courses in semesters 1 and 2. Now, the courses are given the same names through the 4 semesters of first and second year, but obviously each semester contains different learning contents, learning outcomes, learning objectives, and different themes in some of the courses. So we have clinical science courses, clinical practice courses, health society and research courses, and ethics and professional practice courses. These courses are designed to integrate with each other across the semester and also with each other throughout the first 4 semesters of the program. So content and themes and ideas that have been learned and discussed in the first semester are still being emphasised and reinforced throughout the 4 semesters of phase 1. So clinical science is much like it sounds. It is really the basis of science that you need to become a doctor, and it includes anatomy, pathology, physiology, microbiology, immunology, most of the ologies really, but they have a clinical perspective. And students learn these in small groups called case-based learning groups. So from the very first day of the MD, students will be exposed to clinical cases. You're all divided up into groups of 10 students, and you have a clinician tutor for every group. And these groups meet twice a week for 2 hours at a time, and really pour through these cases that are provided and divide up the tasks amongst the group members. So it's a team approach to learning, which is guided by the clinician tutor and the curriculum. The student groups, I think it's important to mention, as I mentioned about the program backgrounds, very diverse range of students, but also we have a very diverse range of students who come from many different locations. We have a large international cohort as well as our domestic student cohort. And within those small groups, it is really not uncommon for students to be coming from 5 or 6 different cultural and national backgrounds, and as well as being provisional entry and direct entry students. This creates a very unique and diverse learning environment for students. So clinical science is along the lines of prac sessions, CBL tutorials and lectures, mostly based here at St Lucia. The clinical practice courses run alongside this, and they are essentially the nuts and bolts of being a doctor, the practical skills that you need to be working as a doctor. So from the first semester, you're learning how to examine your peers initially, learning how to take blood pressures and do pulses and listen to hearts and lungs, and all of those practical hands-on skills that you require to be a doctor. In addition to that, we teach students procedural skills in a simulation laboratory environment, and they also learn to do specific types of communication skills that, as you know, are very essential for medical professionals. The Health Society and Research series of courses really depends on what particular semester, but they are a research component is integrated with a particular aspect of evidence-based practice, global medicine, community medicine, and a number of different themes around that. Ethics and professional practice again, is fairly straightforward in terms of the content, and as you'd appreciate, there's a large range of ethical and legal and professional practice attributes that we are instilling in our graduates. In Year 2, we continue in these same 4 courses. The difference for clinical practice particularly is we actually get our students into the hospital seeing patients from the beginning of second year, and this really engages the students. They are in smaller groups again, groups of 5, and they are placed at one of the 3 major teaching sites in Brisbane, so the Mater, PA or Royal, and they're doing ward rounds with clinicians, they're seeing patients in their own time. They're actually putting into practice the skills that they learnt in their small groups in first year and going into the wards. And there's a huge learning curve. The students are amazing by the end of second year, the amount of clinical information and clinical skills that they have developed. This is also reinforced by more simulation-based work, as well as a series of masterclasses for more specialised clinical skills. So essentially by the end of second year, we aim to have our students ward ready to go and be immersed in the wards in clinical sites in third year. As I said, most of your time in first year will be at St Lucia campus, and this is the most beautiful aerial shot of our campus. And it's probably about September, October, because all the jacarandas are in bloom. And I guess if any of you are already UQ students, you know that that puts terror into your heart, because if the jacarandas are in bloom and you haven't started studying, you're in big trouble. So just a word of warning, don't let that happen. This is just a photo of the Royal Brisbane Clinical School, and the building on your right is actually the University of Queensland teaching building. We have 9 floors there. A lot of those small group teaching simulation labs and things are in that particular building. At PA Southside, we have the most beautiful building called the Translational Research Institute. The School of Medicine has the bottom floor, part of the bottom floor of that building, and access to amazing lecture theatres like this one. So the students have just fantastic learning facilities at UQ. And at the Mater, we've just finished a wonderful renovation of 2 heritage-listed buildings at the old Mater Hospital there, the Potter and the Whitty building. And the students have just an amazing space in the Whitty building there. It only opened a few months ago. So at the end of first year, after having spent pretty much the whole year here on campus, lots of lectures, small group learning, not a lot of patient contact in the first year, we have what's called the Year 1 elective or observership, and it's a compulsory 4-week elective, and all first year students must go and attach themselves to a clinician or a clinician researcher, and essentially anywhere in the world. So students, these are photographs from, I think, last year's first year elective, and I guess as you can see, the students are having a wonderful life experience. The photos actually aren't reflecting a lot of medicine, but we do trust they did a lot of medicine while they were there. But we really want them to go and experience the world, experience a different culture, experience a different health system and health culture, and I think understand probably how lucky we are here in Australia. And we get some fantastic photos and reflections and experiences. And commonly students will say to us, this changed what I thought I might do with my medicine degree. Of course, students are very welcome to stay in Brisbane, and they can also do these observerships anywhere in Australia. So students don't have to go overseas, but a lot of them do. And we are actually very proud that about 85% of our graduating cohort have done some part of their training in an international location. We see that very much as part of our mission as wanting to train global leaders in medicine. That's just a quick snapshot of some of the locations the students have been on elective. I actually think there's quite a few missing, so apologies for that. I'll quickly just mention phase 2. I guess it's quite a long way away for a lot of you. That's the third and fourth years of the medicine program. And this is where students are immersed in the clinical environments. Now, whether that's a large hospital like the Royal, a small hospital like Redcliffe, whether it's a rural clinical school like Rockhampton or Toowoomba or Hervey Bay or Bundaberg, or whether that's doing an overseas rotation, our students do 10 clinical rotations. They're 8 weeks in length, and they do a series of different clinical disciplines like medicine, surgery, general practice. Students are immersed in a general practice in the community. Medicine in Society, which is a rural type of rotation. They do mental health, obstetrics and gynecology, paediatrics, critical care, which is intensive care and emergency and anaesthetics, and they do medical and surgical specialties. So this takes students learning to a completely new level where they are learning on the wards with clinicians from patients full-time, similar to an apprenticeship model in a way. Students in third and fourth year are no longer just at St Lucia or at the 3 main clinical schools. We have a total of 11 clinical schools, including the 4 rural clinical schools that I mentioned. We also have a very unique partnership with the Ochsner Health System, who are located in New Orleans in Louisiana. Every year we take 120 US citizens as part of the UQ Ochsner program, and those 120 intrepid adventurers come to Brisbane to do the first 2 years of the program alongside all of our domestic students and other international students. At the end of second year, that particular cohort returns to the United States and they finish the last 2 years of the program, exactly the same program as our students here. They finish them off in Ochsner. They graduate with a UQ degree and they go on to match into the US residency system, which is a very competitive system, as you'd imagine. And this program's been running for 7 years now, and our match rate of our students into that program, into the residency program, is exactly the same as the domestic students in the US, which is an amazing 93%. So we're very, very proud of our students coming through this program and then matching in a different country. So there's a lot of opportunities for students to experience different health systems and different types of learning, and we strongly encourage our students to spend a rotation at Ochsner as well to see how the system in the US works. The rural clinical schools are part of our program, and we send approximately a quarter of our students to rural clinical schools to study years 3 and 4. And these are just actually the 4 rural clinical schools headquarters, and I just think the facilities once again are amazing. And we have Toowoomba, Rockhampton, Hervey Bay and Bundaberg, and the care and concern shown to the students by the rural communities is amazing. And obviously we're strongly encouraging anyone with an interest in rural to come and have a chat about that, but also to keep their eye out for rural opportunities during the program. This is a photo of one of the main buildings at the Ochsner Health System, and I don't know if you've seen the Royal Brisbane Hospital and you think that's big. This is far, far bigger than the Royal Brisbane Hospital, so it's an order of magnitude greater size. So it's just an amazing experience for our students to go and spend time learning in this environment. It's the largest not-for-profit healthcare system in southern Louisiana, so a huge number of patients and staff. And of course, the types of, the illnesses and the injuries and the trauma are a slightly different theme from the things that our students would see here. So once again, adding to that global emphasis of our medical program. So I'll just hand over to James now to talk about entry pathways.
So that all sounds pretty good once you get in. The question for a lot of people is, how do you get in? So there's a couple of different pathways that I'm going to describe, and some of it will be relevant to school leavers and some of it will be relevant to people who already have a degree. So for domestic students, and I'll focus this on the domestic students, but if there's any international students here, we would be happy to talk to you sort of individually afterwards. But for domestic students, historically we've had around 320 Commonwealth-supported places. Now that number is likely to decrease by maybe 25 or 30 in the next couple of years to around the 300 mark. Of that 320, 160 have been designated to be in the provisional entry for school leavers pathway that I'll talk about in a minute. Of those 160, 1/4 are bonded medical places, so for people from rural backgrounds. The remaining 160 of that 320 are for direct entry for graduates, so people who don't come down the provisional entry pathway but get into a university and get a bachelor's degree at least. So we combine that 320 with the 120 auctioneer students, with somewhere around 80 other international students who are largely Canadians or from Southeast Asia to give our total cohort each year. So the provisional entry pathway, and a lot of this is already happening. If anybody's in grade 12, you're sort of, and you're heading down this pathway, you've probably already sat UMAT. But the provisional entry pathway kicks in when you're in grade 12. So you've got to be in grade 12, you've got to sit UMAT, and UMAT was, I think, was on the 27th of July. So congratulations to everybody who sat that, and I'm sure you're waiting for the results, which I think are out in September. And then you apply through QTAC. So the university and the medical program have nothing to do with managing intake into any of these programs. It's all externally managed for us. So the provisional entry pathway is through QTAC, and there is a specific course code for that when you look at the QTAC website and the application guides. For anybody who isn't in grade 12, who's a bit younger, who's thinking about this pathway, it works as described on this slide, really. You've got to have a rank of 99, okay? So this is always a 1, it's always an OP1, but when we count some bonus points that I'll mention in a few slides' time, you can actually get a lower OP, so a 2 or sometimes a 3, and you can bump yourself up into that 99. You must sit UMAT, okay? It's absolutely vital that you prepare and sit for UMAT. So it's a multi-choice marathon, and it comes up with a score. And essentially all the QTAC people do is take all the people who've applied who've got a rank of 99 and they rank a UMAT score beside it, and when we get down to whatever the cut-off number is, they just draw a line and send out those offers, and then often send out a few more if they're not all taken up. All the historical data around these scores is on the Medicine at UQ website, and I'd encourage you to look at it just as a guide, but they're last year's numbers. So the Commonwealth supported placed UMAT cut-off score was 179 and a little bit, and for the bonded medical places it was 4 points lower. And I would encourage anybody who's going down this pathway who is eligible to apply for the bonded pathway to apply for it. It is a significant advantage if you can meet the criteria. So UMAT, for anybody that doesn't know, is a 3-hour multi-choice exam, and it really assesses critical and analytical thinking at the school leaver level. It's different to the one it's different to GAMSA, which the graduate pathway people sit. It's pitched at that high school leaving level, and the results, as I said, are out sort of late in September. The bonus schemes are important to consider in your application process, and these apply across the universities, aren't just for the MD. So there's bonus schemes that apply to the Educational Access Scheme, the UQ Link program, and for certain grade 11 and 12 subjects. So you get 2 bonus points for doing a language other than English, 2 points for Maths C, and 1 point if you can do one of the university level enrichment courses while you're going through grade 12 normally. Regardless of how many of those you're eligible for, you can only get 5, though you can't get too greedy about it. But they'll cap that at 5. But doing those things also provides a significant advantage in the entry assessment. The aim of the bonded medical places is to provide doctors for areas where we know there is a shortage of medical services, and that's general practitioners, that's rural generalists, that's rural specialists. There's a pipeline for training people into those communities where we know that outside of the major cities and the major regional cities, there is a significant shortage of doctors across the country, but also significantly in Queensland. So all the bonded places are a category of the Commonwealth supported places, so they attract the same sort of HECS fees. And what you're doing by signing up to that pathway is you're committing to work for a time period in a district of workforce shortage. So until last year, that was the length of your degree plus 1 year. So for our students, that would have been 5 years. From last year, it is 1 year, which can be your intern year. So it's a pretty good deal, I've got to tell you. If you're eligible, I would look at the criteria and apply. And you're making a commitment to the Commonwealth Department of Health and you're signing a contract with them. A couple of other special admissions categories that apply to the MD. So there's more for the rural background students and for students from an Aboriginal and Torres Strait Islander background. And there's information on both those websites. And rather than me tell you information which could potentially be wrong, I'd ask you to talk to the admissions people in the exhibition hall at some stage today if you feel you fit into those categories. For provisional school entry pathway, this bit's really important. So when you accept your place, you will have to pick an undergraduate degree to do it. Now, as Margot said, we're not particularly bothered what that degree is. Okay, we're happy for you to do arts or law or engineering or some other sort of science or whatever. But it's important that, one, you meet the criteria for that initial undergraduate degree that you're applying for. So science will have different prerequisites to law, which will have different prerequisites to engineering. So you need to look at those very carefully when you're applying. You have to maintain a GPA of 5, okay? And as hard as it sounds, if at the end of your bachelor's degree, if your GPA is less than 5, the place will be withdrawn. So you've really got to be diligent and keep your GPA up. The only other thing I would say to that is the MD program doesn't have any hard prerequisite subjects. So there are other medical degrees around the country that say you must do A, B and C to get in. We haven't said that. We've got a list of recommended prerequisites, and amongst almost any other undergraduate degree, you can find space to do these prerequisites. So that refers to things like physiology, biochemistry, anatomy and pharmacology to a sort of second year level. And most of those other degrees have got elective space, or there are pathways to be able to achieve those prerequisites. And that, by doing them, that just really sets you up for the first year of the MD and makes life a little bit easier for you. So for people who are coming in who aren't going to be on the provisional entry pathway, so you've completed a degree. So once again, it's a minimum of a bachelor's degree. Some people come in with honours, some people come in with master's degrees, some people come in with PhDs. And some of the things that our graduate entry pathway people have done before they get in is truly amazing. So you've got to finish your degree, you sit what is called GAMSAT, which is similar to UMAT, but it's pitched at a graduate level, so more university level critical analytical thinking skills. And you don't apply through QTAC, you apply through a body called GEMSAS, which not all medical schools in Australia use, but the majority use to manage their graduate admissions pathway. So the direct entry pathway is completed degree and a GAMSAT score, and that score is currently scaled. There's 3 sections and we double weight one of the sections currently. Having said all that, that all sounds like hard work. You know, it's hard work at high school. Everybody's worked hard to be putting themselves in a position to sit here today. Your undergraduate degree is hard work. The MD is challenging and great fun and busy, but it's not all hard work. So these are our 4th year students on what is traditionally called Sports Day at UQ. And I've got to tell you, there's not a lot of sport that goes on, but it is great fun. So the 4th years now all dress up in pink scrubs. They start off with a barbecue at the medical school at Hurston, then they make their way over to this side of town, getting into all sorts of various situations that maybe we're better off not knowing about. But the students, the medical students at UQ are fantastically led by the student organisation. We have a very close working relationship with them. But they do a lot of community work, they do a lot of outreach work, they take fantastic care of their younger students, helping them develop, learn the pathways through the program, helping it. The sense of camaraderie amongst the student body is really one of the strengths of our program. So the MD, it's worthwhile doing, it's great fun while you're doing it, you've got to work hard, but you do have a lot of fun. And really, at the end of the day, as Margot was alluding to at the start, there is something in medicine for everybody. Anybody, regardless of what your interest is, where you want to be, there is something to do in medicine that is incredibly rewarding. So that's all we really had to say. We're happy to take any questions now if we've got any time left, or we're happy to talk to people over at the booth. There's some contact information. Thanks for listening.